What is poliovirus? While poliovirus is a highly infectious virus that can cause paralysis and even death, it is also known as poliomyelitis, or polio for short. Polio is one of the oldest diseases known to humans, and it has been around since ancient times. The virus mainly affects children under 5 years old, however, adults are not exempt from contracting the disease. Structure of poliovirus. Poliovirus type 2 is a virus that belongs to the family Picornaviridae and is responsible for the debilitating polio disease. It is an RNA virus consisting of a single strand of ribonucleic acid (RNA) encased in a protein shell known as a capsid. The capsid itself has 3 distinct parts: an outermost layer of protein coats called PP1, PP2 and PP3, which together form an icosahedral structure. A middle layer made up of 5 proteins, and an inner core formed by the RNA molecules. Transmission and spread of poliovirus. Poliovirus is a highly contagious virus that is spread from person to person. It is spread primarily through contact with the saliva or feces of an infected individual, and can rapidly spread in areas where sanitation and hygiene practices are inadequate. In addition to direct contact, transmission of poliovirus type 1 may also occur indirectly through contaminated food or water. Symptoms and complications of poliovirus. Poliovirus is a serious and potentially deadly virus that can cause paralysis, breathing difficulties, and other severe health complications. It is an infectious disease that typically affects young children, but adults are also at risk of infection. The primary symptoms of poliovirus are fever, fatigue, headache, vomiting, stiff neck and back pain. In some cases, these symptoms can be accompanied by stiffness in the arms or legs. Transmission of history of poliovirus. Poliovirus is a virus that has played a significant role in history. It was first discovered in 1908 by an Austrian-Hungarian pediatrician named Karl Landsteiner. At the time, it was thought to be a mild form of enterovirus that caused little more than cold-like symptoms. However, as more cases of polio began to surface around the world, it became clear that this virus was far more serious than initially believed. Vaccine against poliovirus. Vaccines have long been hailed for their effectiveness in preventing and controlling the spread of infectious diseases, and none more so than the vaccine against poliovirus. Developed by Dr. Jonas Salk in 1955, this vaccine has helped to almost eradicate polio from the world's population since its introduction. It is administered as either a live attenuated or an inactivated version and is extremely effective in providing immunity from this debilitating virus. The success of the poliovirus vaccine is such that it has become one of the most widely used vaccines ever developed, with over 2 billion doses given worldwide every year. Conclusion. The poliovirus has been a major health threat for decades, causing thousands of deaths and disabilities worldwide. Despite this progress in reducing polio cases around the world, it still remains an important global public health concern due to its potential for resurgence. Vaccine-based strategies are essential to prevent new outbreaks from occurring. Until we achieve global eradication of the poliovirus through innovative approaches such as these, we must remain vigilant in our efforts against this debilitating virus.